and your name.
Thank you. Hello, everyone. My name is Shaylin alongside
Germán Parodi.
We are the co-executive directors of the Partnership for Inclusive Disaster Strategies. I'll give a visual description of ourselves, and we apologize for not having our camera on today as we are facing many technology issues today. I'm sure folks can understand that struggle. But I am a younger white woman with long curly brown hair. In our picture showing on screen, I'm wearing a black top sitting next to Germán.
I am wearing a Puerto Rican brown skin male in my wheelchair with my long curly black hair. I'm wearing a light pink button shirt.
And thank you all for joining us today for this workshop on meeting assistive technology needs during climate disaster responses. A little bit about us at the Partnership for Inclusive Disaster Strategies, which we know is a bit of a mouthful, so we also go by the name The Partnership, and will refer to us as throughout today's presentation. We are the only US-based disability-led national organization with a focused mission on equity for people with disabilities and people with access and functional needs throughout all planning, programs, services, and procedures before, during, and after disasters and emergencies. Essentially, we are the boots and wheels on the ground response. We are capacity builders and disability rights experts before, during, and after disasters and emergencies. And what really drives our work in this space is because people with disabilities are 2 to 4 times more likely to die or be injured than non-disabled people in a disaster or an emergency. And this is largely due to the lack of resources and accessible and actionable information that is available and targeted to people with disabilities before, during, and after disasters and emergencies.
Shaylin and I began the disaster response field in 2017 when we were initially deployed to Puerto Rico following Hurricane Maria. Certainly the world has taken notice to the impacts of climate change since 2017, by how it fueled the impacts of what became a Category 5, and certainly following Hurricane Dorian in 2019, which, with over 200 miles sustained winds, was stationary for over 24 hours over islands in northern Bahamas. You all in California, in the West Coast, are very familiar with the rising impacts of climate change. And I'll note that currently, I also hold a United Nations advocacy positions with the Office of Disaster Risk Reduction as the focal point for persons with disabilities in the matters of disaster risk reduction in the Americas. And we're currently working on expanding the work to cover climate action as well. In California and the West Coast, you are noticing climbing changes in disaster work, with the heat waves becoming more common, your snow melting earlier in the spring, and less rain falling. This is expected to worsen in the coming decades, impacting not only our livelihoods, but one noticeable quick impact is being understood as the supply of water. You're noticing certainly the increase in wildfires, and today already parts of New Mexico, parts of Nevada, and certainly Arizona are already experiencing evacuation needs. We are in March, certainly this year, in collaboration with, most of you may be familiar with your colleague, Vance Taylor. We do a lot of collaboration, which will go on in moments. But just to give you painting a picture of the climate impacts, not only is the rise in wildfires, in drought, impacting the water levels in Lake Tahoe, with its natural rim being lower than expected, impacting flow throughout, and issues with the sea level rising, compounding what potential drinking water availability there is throughout the region, not pointing out the ongoing issues with the river basin. When we're encountering climate action races, we, in the matter of assistive technology, also often think first of the high-tech communication devices, but being deployed to Puerto Rico, seeing firsthand, for example, a community of death of over 3,000 people in the interior mountainous regions of the island who use a deaf pidgin language, low-tech AT like communication boards and pictograms not only would have facilitated our explaining of available aid coming into the area, but also limits the ability of persons with disabilities that need this type of assistive technology in accessing FEMA individual assistance applications, leading to a large gap of over 70% of applications being denied.
Other examples that we see in disasters that are needed in terms of assistive technology, from, as Germán mentioned, communication boards, or even just a piece of paper with different communication phrases in picture format to facilitate those types of interactions are really helpful in terms of having a quick resource to pool. But with that is in terms of preparedness, we all know that we have to prepare our information and our Go kits in a way that is maintained. So perhaps a piece of paper with those pictograms that is, what is the word I'm looking for?
Depicting.
That is covered with, like, in a plastic bag, or there's a word I'm missing, and I'm sure others will find it for me. I apologize.
Laminated.
Yes, laminated. Thank you. A laminated piece of paper and or other types of pieces like that to be able to have that easily accessible, but also be able to sustain a disaster if needed. To things like special purpose computers or software on computers, screen reader type of software, other types of softwares that go onto devices for communication, but also things like, we know assistive technology is a wide range of things that could include things like prosthetics and mounting systems and positioning devices, things like special switches and keyboards and pointing devices. Having communication programs and softwares for screen readers, and more types of communication software. And assistive technology can be inclusive or specialized learning materials and curriculum aids, things that are meeting people where they are at. And much more, as we know, electronic devices, things like our durable medical equipment, like wheelchairs and walkers that are customized, and braces, these types of pieces that help us maintain our independence and daily living throughout each and every day. But when a disaster strikes, and now that they are striking in more frequency and intensity due to climate change, is important that we not only prepare for what could happen to our devices, but also the resources that may be available in our communities when we're in need of them after a disaster.
With more high-tech level supplies, certainly AT centers, we collaborate strongly throughout the country, and also with FODAC.
The Friends of Adults of Disabled Adults and Children.
But with customized wheelchairs, something that we have supported in the US, but also in South American countries in the past 2 years. We have a alliance with the World Institute on Disability and a Chilean colleague organization called Inclusiva, who focus on disasters and people with disabilities as a sole mission of the organization, called the Global Alliance for Disaster Resource Acceleration, or GADRA. We have supported in disasters following hurricanes, but thinking of the evacuations that in no sudden emergency take place, like wildfires, where you must evacuate it within minutes sometimes or little notice. If you're blind or of low hearing, and the AT supplies, like Shaylin was explaining, the proper hardware, specialized cell phone, for example, or tablet, with the programs that you need to access it clearly, it is things that we are supporting Colombia and other Central American countries north of Colombia with the Global Alliance for Disaster Resource Acceleration, as well as following the earthquake in Haiti in 2021, just last year, summer. Right now, we're supporting with multiple AT that allows students with disabilities, children and adults, regain education. When you have to evacuate, this list should also not only include, as it's been mentioned, and you see in many checklists, your medicine, your contacts, but what will be the assistive technology that you won't be able to evacuate with, that you may quickly need to replace, that is individualized to you and your communities? But those are parts of the conversations that need to be had, in including people with disabilities in preparation and exercises. Other simple AT has been in the Bahamas. We supported multiple families and their children with different developmental disabilities with low-tech AT, as simple as widgets and
fidget spinners, those type of sensitivity stimulation devices. In the Bahamas, we had seen many younger individuals with disabilities that not only was this just a piece of usefulness to distract from the situation that they were facing, and in the dire situations, but also in terms of being able to have some stimulation and something to play with. We also saw, in terms of assistive technology in the Bahamas, a big need for diabetes supplies, things like heart monitors and sugar level monitors. We see this in every disaster, the need for insulin and being able to storage, keeps the insulin in storage levels that are needed and temperatures. The medications that are needed to maintain independence and stay at home. But mainly a big need we see throughout every disaster is the need for oxygen refills and the access to oxygen for people who use them and use it in their homes. Overall, these are things that continuously are the different disproportionate impacts people with disabilities face before, during, and after disasters and emergencies. Largely, again, as I said, because of the lack of access to resources available in the community. And one way we help bridge that gap at the partnership is by bringing together local disability-led organizations, local community-based organizations, and emergency response officials, emergency management agencies, folks from the Red Cross, other decision makers in local, county, and state levels to come together and address this need, this disproportionate impact, and ensure that we are not only including people with disabilities in planning and recovery and throughout all phases of the disaster, but prioritizing people with disabilities in a meaningful way that actually gets our needs met during a disaster. To talk a little bit about how the partnership engages and some ways that we can continue our collaboration, some actionable items, if you will. We shared in our resource materials a one-sheeter that could be technically a two-sided page, more about the partnership generally. And we also have a resource document of some various resources throughout our time and throughout our partners as well, some highlights for folks to be connected with, I'll touch upon as well. But in terms of our capacity building expertise, we provide a wide range of services, including that are tailored for all types of organizations, whether a community-based organization like a Center for Independent Living or an AT program, for emergency management agencies or businesses and corporations. We are able to tailor a wide range of our services to meet their needs around inclusive emergency management for people with disabilities. We have a wide range of trainings that can be customized around these topics for emergency management and around public health, certainly with the ongoing COVID-19 pandemic. Including also statewide inclusive emergency management conferences, where we've been successful in facilitating and coordinating conferences, bringing together those local advocates, people with disabilities in those areas with emergency management agencies, public health officials, statewide leaders and decision makers, policy makers, together at one table to address systemic issues and work towards strategies to mitigate them. We also provide services like gap analysis and continuity of operations plans, identifying where the gaps are in your own plans and services and in your organizations, and providing a roadmap of a plan for continuing your operations during any type of event, whether a disaster, an emergency, or as we have been throughout these past 2 years, a public health emergency. We also help facilitate exercises and drills, coordinating that amongst your team and going through it step by step. And the main thing about exercises and drills, I think, is really important to highlight is not to perfect our plans, but to break them and to identify where our gaps are and to work towards how we make them better and inclusive of people with disabilities. Things like incorporating people with disabilities in our exercises and drills instead of, having somebody role play that part of a blind person, for instance, or a person in a wheelchair, but having really those people with lived experience involved in those exercises and drills.
Before we carry on a different topic, we see a hand just raised that perhaps there's a question pertaining to current information around the exercises.
Yeah, I'll go ahead and unmute, allow Rick to talk.
Anthony, you're not coming through clearly.
Can you hear me? Can you hear me now?
Better.
Yes.
Better. Okay. I'll go ahead and allow Rick to talk. So Rick, if you want to ask your question verbally, that would be great. Rick.
Okay. Yeah, I'm sorry. I had to tab to mute I had to tab to unmute myself. I put who I was in the chat, but not really a question, but no matter what AT that which you use during any type of disaster and or an emergency, if any of them require batteries, make sure that those batteries are charged. If they require, make sure that, make sure that they're plugged in overnight, whether it be a cell phone, because I always have my cell phone plugged in, my iPhone, which is an Apple, plugged in overnight. And speaking of batteries, make sure that you have a first aid kit, and make sure that you have a small handheld pocket-sized transistor radio. This is one of those low-tech LT-AT type of devices. And also make sure, speaking of batteries, make sure that you have extra batteries with you in your first aid kit as part of, so thank you.
All right, thank you, Rick.
This is Germán. Good points, Rick. Thank you for bringing them up. Power outage and rolling outages you are experiencing in I would say in the mainland, are a prime example of the issues. I keep reminding folks that in Puerto Rico, following Hurricane Maria, the electric infrastructure grid broke completely, and now there are still close to 3 million inhabitants, and over the last 2 weeks, over 1 million people are experiencing unannounced power outage rollouts for a day or two. The implications on this for people who are power dependent are extreme. The rising cost in fuel availability, as you all understand, are extreme and unknown in the coming time. And most of our community are people who are in fixed income, putting them in the poor scale, if you will. Extremely problematic. One compounding issue is that in disasters, but also in blue sky times outside of a disaster, when people have to relocate across state lines, their Medicaid, which covers their health insurance, the CHIP program for children, and long-term services and support, including home care, home and community-based services, are not services across state lines because they are funded through Medicaid. In a disaster, this is extremely problematic, as many people with disabilities and older adults, even if they are on Medicare, if they are receiving long-term service supports, these are covered through Medicaid. There is a federal congressional legislation called the Disaster Relief Medicaid Act that would change this and would support states that are impacted with a presidential declared disaster, and states that are receiving evacuees, supporting them with 100% federal Medicaid match for 2 years after the presidential declared disaster for people on Medicaid. This means that if people on California, like you, have to relocate temporarily or permanently to a state like New Mexico or Nevada, which may not cover all your Medicaid services, these states would need to cover all the services that you were provided in your state with expedited enrollment and no recertification for the duration of the declared disaster with a duration afterwards. And these states will be supported by HHS to be able to provide these services in states, as you may understand. Once you cross states line, many services are not provided, as Medicaid services are still a waiver. They are not a right. Your home and community-based services are not your right. Unlike the nursing home, this is a different issue that you all know we have a lot of advocacy to do and has been done for decades. But the Disaster Relief Medicaid Act would begin addressing this, and separately would create a pilot program for a emergency response personal assistance corps. Initially, the bill has a 5-state pilot. California may be prudent, as we know. Personal assistance services are crucial during a disaster, and our natural services are also impacted in the disaster. So having a core group prepared to respond, it will be critical in the years to come. You can find out more around the Disaster Relief Medicaid Act at www.reaadi.com. Well, I'm talking about that acronym. READY stands for
the Real Emergency Access for Aging and Disability Inclusion, READY, REAADI, Ready for Disasters Act.
READY is the flagship companion bill of DERMA, the Disaster Relief Medicaid Act. We had the partnership with some of your colleagues in California, including June Kales, worked on drafting both legislations between 2018 and 2019. By the way, currently DRMA was introduced by your Congressman Panetta in California, and he is also a co-sponsor of READY. READY will create a disability and disaster training and technical assistance, and separately a research center, one for each region across the country, and a national project of significance focusing on people with disabilities and disasters. It will also fund GAO, the governmental
Office of Affairs,
to do a study on
accountability.
That's what I thought. Thank you. To do a study on the impacts of disasters on people with disabilities going back to Hurricane Katrina and the mismanagement of federal funds allocated throughout. READY is a piece of legislation that will change the focus of people with disabilities being only seen as vulnerable in disasters and create a body that recognizes us as being part of the response, thus making us part of the emergency response body, including us, emergency management body, including us in mitigation, preparedness, response, recovery, and reconstruction. More information on both bills at ready.com, REAADI. The bills would expire at the end of this year, and we just had a congressional virtual briefing. You can find its recording accessible at the website.
In terms of, and we hope folks take a look at those pieces of legislation, and please reach out if you have any questions. We'll pop our email in the chat in a bit. And certainly the need for ongoing advocacy and education around these needs is paramount, especially as we are approaching our regular disaster season, if you will. Although I think it's fair to say it's here every day, but hurricane season starting at the beginning of June and wildfires already within California.
One last point is that Centers for Independent Living and other disability organizations respond in disasters, support their communities in preparedness and recovery. However, it is difficult to access FEMA reimbursement as disability-led organizations are not recognized as private nonprofits in FEMA reimbursement guidelines. READY will also amend the Stafford Act, recognizing directly sales and disability-led organizations as members of the response body, easing the mechanisms for reimbursement from FEMA. I'm sure you all will be more interested in that. Again, please reach out to us at directors@disasterstrategies.org if you'd like to learn more. And we are planning to hold a national call-in day in mid-May, so more information to come.
To share a little bit more about the partnership and how we can engage with one another and use each other as a resource throughout disasters and emergencies, I'll start by saying some of our community engagement and support comes through our disability and disaster hotline. That information is on the resource document we shared, but I'll say that number just for good measure here. Our disability and disaster hotline is 800-626-4959, or we can be contacted at hotline@disasterstrategies.org. Our hotline mainly serves as an information and referral resource hub during disasters. So we really are a place where people with disabilities across the nation are able to call in, connect with us, and we are able to then directly connect them with resources closest to them that meet their needs and are able to directly connect with people with disabilities in need. So these can be a wide range of types of resources between, basic needs like water and food supplies that we connect with direct relief organizations around, but also things around disability related information, supplies, resources. So a lot of times we find ourselves connecting with the local Center for Independent Living, AT programs. We work closely with Christina Mills at the California Foundation for Independent Living Centers.
And even supporting people with disabilities in expanding their hotels, non-congregate stays after the wildfires. Oftentimes, the hotels, for multiple reasons, attempt to, let's say, kick out people, and without proper advocacy at your state level, Vance Taylor has been able to mitigate this multiple times through our hotline.
Big encouragement for folks that may be providers or serving people with disabilities during a disaster, that if you don't know where to maybe turn, or if you have a question that needs addressed in your area in California, Vance Taylor, your access and functional needs coordinator, is really an invaluable resource. He's able to not only do what he can personally, but certainly connect then further throughout the state of California to available resources and directly with people that can make a difference or an impact. And so one really encouraging thing I want to say around our disability and disaster hotline is that if you are a potential partner that when a disaster strikes, you'd like to share our hotline, we really encourage folks to share it across your networks, but also share with us your capacity and ability to serve and connect people with disabilities with resources that you may have available or know of. Is really valuable to us to be able to directly connect people who contact the hotline with available resources in the local communities. And so with that, I really encourage folks to check out our website, disasterstrategies.org. There's many resources there. Particularly, we have a page called Our Partners. And if you would like to be listed as one of our partners, there's more information there. When disasters strike, we often reach out and support our fellow disability-led organizations that are doing that direct response on the ground and supporting them in all of the ways that we can with high-level technical assistance and connecting to potentially other relief organizations or federal agencies that may be involved, to also direct navigation of systems and ongoing support. We also have a couple stakeholder engagement opportunities if folks are interested in joining us. We hold a weekly national stakeholder call every Tuesday at 3 p.m. Eastern Time, which is 12 p.m. Pacific Time, where we have a wide range of stakeholders that come together across the nation, from American Red Cross to local disability-led organizations, local emergency management agencies, and federal partner agencies like the Department of Homeland Security, FEMA, and others who join us. And we work towards the systemic issues and strategies towards making sure we're prioritizing people with disabilities in our direct responses and as a resource connection hub on a weekly basis. And then since the COVID-19 pandemic began in February of 2020, we began sort of drafting a call to action, which is available in the resource document we shared, that addresses the urgency to prioritize people with disabilities in the public health response, which we have seen time and time again throughout has left gaps for people with disabilities throughout this public health emergency. And so since that drafting of that call to action, we've continued to meet and gather daily, each and every day at 6 p.m. Eastern Time, which is 3 p.m. Pacific time, where stakeholders across the nation come together, from folks that represent the CDC to Red Cross daily briefings on high-level national information that is not otherwise publicly available. We have the local USEDs and other partners from disability-led organizations, as well as disability advocates and national organizations like the World Institute on Disability, the Association of Programs for Rural Independent Living, April, and others that join us, like statewide independent living councils and ARC chapters and advocates that we all know. I believe June Kales is probably a familiar name in your areas, and as well as Marcy Roth and others that come together to really provide resources, share information, and continue to support one another throughout this pandemic, which we all well and know that this is not over. We are still within a public health emergency, a pandemic that is disproportionately impacting people with disabilities, particularly people with disabilities who are in congregate settings like nursing facilities and other institutions. And we just continue to bring each other together to share those resources and high-level engagement with one another. Just to cover some of the resources that we shared with you for this presentation for folks to take away and use and share within your networks. The resource document we shared has many of the things, but much more that was not covered today, like a information sheet on knowing your rights in a disaster around disability rights and immigrant rights. That's available in English and Spanish. A bit of more about the partnership and what we've done in the past in our 2021 year in review, which is also available in English and Spanish. Some resources that we've propagated through our daily COVID-19 disability rights calls, our different call to actions, but there are many resources that have come out of there. As well as I want to highlight in this resource document, particularly from the National Council on Disability, a report called Preserving Our Freedom, Ending Institutionalization of People with Disabilities During and After Disasters, is a highlight of the disproportionate impact people with disabilities face in disasters. When it comes to institutionalization, oftentimes we find that people are institutionalized more during disasters and are more likely to be institutionalized. And once you go into any type of institution, whether a nursing facility or other type, it is very difficult to get out. Some other resources that are listed there are some of our engagement sessions with, such as the Department of Homeland Security, Office of Civil Rights and Civil Liberties, and a disability community stakeholder listening session we held last year, as well as a stakeholder meeting held with FEMA's Administrator Deanne Criswell, which was held last year. And some of the ways that you can get involved with us, as I went over, is available in that resource list, so it's easy to capture, including the services we offer and more about us and how to follow us on social media. We really look forward to connecting with folks. As we said, our email is directors@disasterstrategies.org. We want to partner with folks to make sure that we are working together in preparation and during and after disasters and emergencies, so that we can make sure that we are meeting the needs of our communities, as we often find we are left behind by other responsible parties. So it's really up to us. It comes to, at the end of the day, people with disabilities helping other people with disabilities throughout disasters. And we look forward to working with all of you, but looking forward to hopefully some questions that folks may have.
I'll
Thank you,
close with
Shaylin and Germán. So we do have one question from Rick Hodgkins. So I'll go ahead and allow him to talk. Is that okay?
Okay. Thank you, Anthony.
All right, Rick, you have the floor.
Okay, you said that you have had numerous and various different meetings with people here in California. I'm a client in the IDD population. Have you had, I know that you said you've had numerous and various different meetings with numerous and various different ARC chapters. I am not a member of any ARC chapter, although I am a member at of the ARC of California at large, Easter Seals, UCP Collaborative. What about any of the regional centers here in California? Because I am a member of the most largest regional center in California, Alta California Regional Center, which actually serves 10 counties. That's the most of any regional center. I don't know if any of you are aware of the regional center system in California. We are the only state that has the Lanterman Developmental Disabilities Service Act. So, and my question for the moderator is, how do I leave this, when this workshop is over, how do I leave this to go back to the lobby? Because when I left the general conference room, I had to go back to my email and get in and enter this that way. Thank you. Thank you.
This is Germán. While Anthony gives us the technical answer, nationally, Rick, we collaborate with the National Association of Councils on Developmental Disabilities. We check in first with them to connect us with a local chapter. Separately and directly in California, as Shaylin mentioned earlier, although it's a bit different, but I'm surely it interacts. We strongly collaborate with the California Foundation for Independent Living Centers. Speaking, I would say, bi-weekly with Christina Mills, the executive director, and in times of disasters, we offer the states or the impacted area to host a daily call as frequent as they can to bring in all disability members and representatives in the area, emergency managers, American Red Cross respondents at the local level, as oftentimes many small relief organizations also pop up, and focus the conversations on the needs, the gaps on people with disabilities, and how to respond to them. But Anthony, there was a separate question from Rick around technical support.
Yeah, thank you, Rick. So I just put the direct link to the conference lobby in the chat. So if you can save that link, that would be awesome. And then Rick, did you have another question? I'll go ahead and allow you to talk. So Rick, you have the floor.
I don't know if I could save that link because I use my keyboard for keyboard commands, not the mouse, because I'm blind. I don't know if I can save that link, but they should in the future, that when we have these conferences from next year going forward, that it should automatically allow people to, whether they use the keyboard or the mouse, to navigate their way around the conference, to automatically work their way from the main conference room to the workshops. And I made that notified. I made a note of that as well to the people back at the CFILC office. So thank you. I will make sure and do that, so I don't have to go back through my email.
Yeah, thank you. Do you have, yeah, thank you for your feedback. And then if you want to send me your email, I can assist you in that way as well.
Great, thank you.
All right, does anybody else have any questions for us at this time?
This is Megan. It's really difficult to hear you, Anthony, but I was hoping that we could do our drawing as promised in the main session. We are going to be offering a go bag to somebody who attended this session. So if it's okay, Anthony, are you ready for us to do that drawing?
Yeah, go for it. Thank you.
Perfect. I'm going to just scroll through the attendee list and let's see. I have landed on Laura Agrigman. I'm going to go ahead and hand you the mic, Laura, if you want to share where you are and then share your email in the chat so you can get that go bag.
Hi, I'm Laura Ackerman. I'm from Ohio, Columbus, Ohio Agribility, and I'm really excited to be here. So this is great. I'm getting some California type weather today. It's gorgeous outside. So thank you for sending the great weather, California.
Congrats, Laura, and we're so glad to have you here. And we must have got your weather because we had hail and rain yesterday.
I'm so sorry. We had that a couple days ago. Yeah, I don't know how California is, but in Ohio, you can experience all the seasons in one day. So, yeah. Thank you.
This is Shaylin, and Germán and I are in Pennsylvania, Philadelphia, so we certainly understand feeling all the different temperatures of the day. But it seems that climate change is certainly demonstrating itself in both your areas. And congratulations, Laura.
Thank you.
We were happy to be able to present to you all, and I'm sure this is the first workshop. We hope you enjoy the rest of the sessions. And again, we can be reached at directors@disasterstrategies.org and find more information on our website, disasterstrategies.org. We also manage ready.com. Know it is a trusted source. And I'll close with, right now, we are directly supporting a Ukrainian disability women-led organization called Fight for Right. They have been helping hundreds of people with disabilities evacuate the war. They have thousands of people that have called and are supporting not only evacuate, but shelter safely in place. And I say, started with, this is a disability organization. It falls on us to support our people in disasters because nobody else focuses and knows our needs as we do. We are the subject matters of our lives and experts in access and what we need. If you'd like to learn more and follow our support and their activities, you will find them on our tab on our website, Ukraine Crisis, on our website, disasterstrategies.org. Thank you for your time.
Thank you so much, Shaylin and Germán, for presenting today. You are very much appreciated. Yes, and I dropped the link in the chat a couple of times, and also their direct email if you want to get in touch and stay in touch. All right, thank you so much. Does anybody else have any lingering questions for Shaylin and Germán, or just thoughts? And it doesn't look like we have any at this time, but thank you everyone so much for your time.
This is Megan. Thank you so much for joining us. We'll have our next set of workshops at 11:30. So we hope to see you there. The workshop 3 is on accessible farming, and workshop 4 is on reuse, keeping wheels out of landfills. So thank you for joining.
Okay, we'll see you.